it's so simple, but it's not so simple. I'll give you an example. So I actually have a device here, a continuous glucose monitor device. Now, something that I did while I opened it, I don't know what I did. I was planning to use this because one of my clinicians gave it to me and I said, sure, I want to try it. Something that I did bent the needle and now I can't use it. So there is the step one of how do you use the device? How do you navigate, a lot of like complex like directions and simplify it, right? We work really well with our manufacturer partners to make sure that we're educating folks on just making sure that initial experience is good. But in the case of something like this, I got this shipped. I know my insurance is going to cover so many, and I bent the needle. And I have type 1 diabetes. It's kind of a panic, right? What do I do? Who do I call? And and it's nice to be able to pick up the phone and say, "Hey, CCS, listen, I need help. This happened," and then have somebody on the phone say, "Don't worry about it. We'll ship you one. You'll get it, blah, 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 and we'll walk you through it." So, or if one of if the sensor comes off, right? So I think it's far beyond just the how do you put it on, how do you interpret it, and how do you use it. It also then has to go beyond that to include troubleshooting when things go wrong. Like an internist, by the way, who should know how to do this, but bent the needle. So the big takeaway is the management of type 1, the lifestyle, everything that goes with it is different. Not always harder necessarily, because that doesn't mean type 2 diabetes isn't hard, but it certainly comes with a very different set of challenges because the room for error is very small, right? A small error, right, in management can land you in the ER, and the hospital. And so, making sure that the support, coaching, and education for those patients is always on target and timely and well thought out is really important. And then also to your question earlier, it's not just about directly managing and helping the patient with the coaching education. We also then have to make sure that we're holding that provider close to us as well, so that we're unifying the care pathway and we're being an extension to them. We're not prescribing, we're not interpreting, we're not, right, we're not the doctors. We just want to help the doctors take better care of their patients.